care behavioral health because I get to work with patients who often wouldn't be in a psychologist's office. The stigma is less when patients are seen in a medical office just down the hall from where they're seeing their medical provider. I also love that the work I do is never boring. I see patients with a variety of medical and psychological problems. I also get to work on educating providers about the other ways to help their patients. Primary care providers feel like they get to have very quick access to psychologists for questions where they're concerned. It helps them to handle patients where there are behavioral issues, medication compliance, and helps them with assessment around psychological issues, and really that kind of seamless collaboration helps primary care providers feel more confident in providing better care for their patients. Colleagues, what you find is that you have access to a whole different group of patients who wouldn't ordinarily be coming in to see you, which opens up your access and improves the number of people you're able to help. So one of the things that I love as a psychologist about practicing in a team model is that I can focus on doing the work that's within my specialty, and I can hand off the things that are outside of that area to the appropriate specialist. Symptoms, it's really very helpful, and it makes the burden less for any one patient, particularly for difficult patients.
Well, one of the ways that it benefits patients is access. So patients can see us often pretty quickly after they've met with their primary care provider. The other way that I think that it benefits patients is they're getting brief psychotherapy, so they're getting the appropriate level of care at the right time. And when they need more care, they're getting seen by somebody who is trained in making those decisions. I love the pace of primary care. Primary care is a little bit more fast-paced. You find yourself working even when you're not in the room because you're consulting with the providers and answering questions, helping them come up with plans on how to address different things with their patients, whether you see them or not. It's a lot like other clinical work in that you're still looking to provide the most accurate diagnosis possible, but in this environment you just try to do it a little bit faster, and that's a challenge, but a lot of fun and keeps you on your toes.
I mean, I think it's just excellent patient care. I mean, imagine that you are shopping and you know you want a refrigerator, and you go to the store and you ask the salesperson for a refrigerator, and they say, all right, we'd love to help you with that, but you're gonna need to come back in 3 to 4 weeks to talk to somebody about refrigerators. I think that would be upsetting for people, and so when our patients come in and they have psychology concerns and they want a referral to psychology, the fact that we can meet them same day and address those concerns and they can talk directly to an expert about what's going on, I think is really powerful, and it's just good customer service. I like the pace. I mean, it's very fast paced. I think it's exciting work. You really never know what your day is gonna look like. I can look at my schedule but know that I'm gonna meet families that aren't on my schedule, and you know, I kind of have to think on my feet, and it is constantly challenging me to apply my skills in a different way. So one of the first families I ever worked with, you know, she had pretty severe mental health problems, and each provider that she had gone to, she was kind of describing different symptoms, but nobody had really put all those pieces together to fully conceptualize this patient, and it turns out she was having much more significant and severe mental health problems than anyone had realized. And so I kind of got into her chart and built rapport with her right away, and mom really trusted me even though she was really untrustful of a lot of providers, and opened up to me about a lot of things that were going on, and the school was able to do psych consults, and we just have these sidebar conversations on a daily basis about, you know, at what point do we refer to psychology, at what point are things concerning. I'm constantly providing education to residents who come through the clinic about mental health and what to look out for and when to refer, and I think that's improving their knowledge base and patient care. At this point, you know, we've had so many of these conversations. You know, the nurses are also in our workspaces and they're overhearing these conversations, and now I have nurses coming up to me after rooming a patient and saying, the provider's probably going to consult you on this patient, because they already know the signs and what to look out for and the types of patients I see at this point. And I think that's fantastic that we're all thinking about it.
It's the right thing for patients. I mean, that's really what it comes down to, especially our patient population. patients' mental health is the fundamental part of helping make our population healthy. And so this is the right thing to do for patients.